Hi, welcome to Dr. Brainwaves. I'm Dr. Rena Azar, and I'm here to talk to you today about sexually transmitted diseases. One of the points of this conversation is very much like a point they were trying to impress upon you when you were a teenager, or if you are a teenager, in your health sex education course, is that sexually transmitted diseases can be very serious. And many of them can be avoided, and it's important to know if you're at risk for them, which is simply going to be sexual activity, be aware of symptoms, and go in and get checked out, because there are some long-term, very negative things that can occur if you have a sexually transmitted disease and you do not get it addressed. So today we're going to go a quick overview, and that overview is going to include some diseases that you will have heard about. Most of these diseases are diseases that are common in the United States. I'll bring up a few that have become increasingly more prevalent in the United States, although they are still rare. And this covers most sexually transmitted diseases, but not all of them. It definitely covers most of the diseases that we have in the United States. So I'm going to talk about gonorrhea. Gonorrhea is a bacteria. It is known for causing pelvic pain, pain with urination, discharge from the vaginal area or the penile area, and it can cause discomfort, but some people can be asymptomatic. I frequently tell females who say, well, he didn't tell me he had anything, then men more than women will generally tend to be less symptomatic than women. So your partner may very well say to you, hey, I'm not having any signs, I don't have anything. And he's probably being honest with you, because oftentimes men do not. So gonorrhea is something that can cause those vague symptoms that we just discussed, much like chlamydia, Trichomonas, and also Mycoplasma. Those are all diseases that cause discharge, pain with urination, vaginal and penile discomfort, pelvic pain, like in the suprapubic area, lower part of the stomach. And those symptoms are subtle, and all of those diseases can be completely asymptomatic. All of those diseases can help you to get an infection that goes deeper inside called pelvic inflammatory disease. By help, I mean if they get into your genital tract, they can work their way higher up into the female genital tract and precede a whole bunch of other bacteria coming up in that area and causing a very bad global infection throughout the female pelvic tract, which can render people infertile. That is a major complication that you can get from any of these 4 sexually transmitted diseases that predominantly presents as some mild discharge, actually. People will rarely get fever or chills from these diseases. Gonorrhea has the complication of causing arthritis-like symptoms as well, which can be pretty severe. So those are the disease processes that cause discharge, pain with urination, and they're all of them curable with medication. So one of the things I'm going to keep repeating here is, if you have strange symptoms, if you don't know about your sexual partner's status, come and get checked out, because you don't want to have long-term problems associated with untreated sexually transmitted diseases. There are some diseases that cause painful ulcers, and these ulcers are usually accompanied by swollen lymph nodes in the private parts, in the groin area, sometimes in the perirectal area. The lymph nodes are swollen nodules that are underneath the skin, and it's part of the body's defense mechanism to swell when we're trying to fight off diseases, and that includes cancers or also infective processes like sexually transmitted diseases. So these conditions that cause ulcers in the genital area are lymphogranuloma venereum, also herpes, which is a little more known and definitely more common, and chancroid. So chancroid and lymphogranuloma venereum are both diseases we don't see a lot in the United States, with the exception of men having sex with men. They are generally found much more frequently in other countries, Africa, South America, Asia. And so we don't see it commonly in the United States, but we have seen an increasing amount. And we like people to keep that in mind when they're being evaluated for ulcer disease. Herpes type 2 is the genital herpes. I have a video series on that, but that is a frustrating viral disease that causes ulcer outbreaks. On the other hand, even though it's not curable per se, it is a disease that is not fraught with some of the severe complications like we see with other things such as HPV, which is a cancer-causing virus. So those are ulcer-forming STDs that you need to be thinking about when you go in to be evaluated. Remember, it's important if you have a travel history to mention that to your provider, because even though the first two that I mentioned are relatively rare in our country, you can pick up diseases in other places. So that might not be considered or first in the mind of a provider in a country like this where we don't see those diseases very often. So we made reference to herpes papillomavirus, and I have a video series on that. Herpes papillomavirus is a group of many viruses, well over 100, that are creatively named HPV 1, 2, 3, etc. You get the idea. We know which ones are related to a risk for cancer. Cancers that are related to herpes virus are in the genital tract, vaginal, vulvar, cervical, penile, perianal, and in addition to that, the oropharynx, the mouth, the nose, the throat, the deep right ear, the tonsils. Those are areas that are all at risk for developing cancer related to that particular virus. In addition, another problematic side effect of that sexually transmitted disease is warty growths, uncomfortable warty growths that can occur in the mouth area, but probably more often in the genital area. These diseases, being viruses, are not curable per se for most people. There's always going to be a risk for them to reactivate in the body, but we can monitor for them and make sure that they don't allow the formation of cancerous cells, for example. And speaking of viral infections that are not are recoverable, we're going to talk about the hepatitis virus, hepatitis B and hepatitis C. Those are both sexually transmitted diseases. So these disease processes first infect people and really seldom cause symptoms that are very notable. The symptoms are a little subtle: fever, nausea, fatigue, and only about 30% of people will recall feeling those symptoms. Occasionally they'll have a little bit of a rash, hive type outbreak, or even some joint pain. We call that arthralgia, joint pain. So about 30% of people will have symptoms, and what oftentimes happens is that after that initial, what we call acute infection, that virus can set up camp in your liver, and that virus can cause damage to your liver. The liver is a very important organ. We'll talk about that in the hepatitis video, but when you have an infection in your liver can become harder, and the blood vessels change, and it can no longer do some very important functions that it's supposed to do, and it can become increasingly sick. In addition, when you have this disease process of scarring in your liver and dying cells and regeneration, trying to overcome the scarring, eventually people will sometimes develop cancer, and liver cancer is a very serious cancer. And also people can develop problems with liver failure. Ultimately, people can end up with end-stage liver failure, and the cure for that is only a liver transplant, because we have to have a liver to live. So one important comment related to these hepatitis diseases is that you should get tested periodically for them if you're sexually active with multiple partners or partner that may not be monogamous. And the reason is because most people don't know if they have that hepatitis infection, and even if they know they have it, people can develop problems way down the road. There's a lot of what we call reactivation of that virus, and there are some serious lifestyle modifications that are very doable that can keep you from getting the very serious complications of hepatitis, which include cancer and complete liver failure. So you need to know if you have that. Most people who are symptomatic from hepatitis are symptomatic at the late stages. So most people don't know they have it and present in the late stages of liver failure, liver cancer. So a serious disease process, sexually transmitted, and you want to make sure not to miss that. One final disease process is something that is newly designated as a sexually transmitted disease. It is a little bacteria called Shigella, and it is one that is transmitted mostly with males having sex with males. We call that MSM. And it causes rampant diarrhea. That's the main symptom of it. But it can also cause problems with long-standing issues such as joint pain, kidney failure, liver failure. And so we like people to be aware that that is also a sexually transmitted disease to be watched for. And it's a little unusual because most of the other sexually transmitted diseases that I referred to earlier were having symptoms like pain with urination, pelvic pain, pain with intercourse discharge. Hepatitis, of course, is generally asymptomatic in its dangerous, more chronic stages. And the other symptoms associated with sexually transmitted diseases are ulcers. So rampant diarrhea can be a sign of a sexually transmitted disease. I hope you found this helpful as an overview for sexually transmitted diseases, and I have some videos detailing more information on each one of those. Thank you for joining Dr. Brainwaves.